everyone. I'm Ellisha, a clinical psychologist and mental health advocate from Souls Health. And no, I cannot read your mind, otherwise I'll be effing rich and not working in an NGO, obviously. Souls Health is a community health, community mental health center under the Souls 247 Foundation. And we were established in 2015 to address the barriers of mental health, stigma, huge stigma in Malaysia, accessibility, affordability, convenience, and also a lot of the mental health practitioners are not trained in community development. What basically means is understanding the communities. So we go back to the basic economics. There's a supply and demand issue in mental health in Malaysia. We don't have enough practitioners, so lack of supply, and the demand is increasing. However, because of the stigmatization of mental health, we see that despite the demand, a lot of them are not talking about it to their family members, not getting access. So about 1 in 3 Malaysians have mental health issues, not disorder issues. However, most of them will keep quiet because of the stigma or may not know, lack of information, where to go to, what kind of services. People always confuse psychiatrists, psychologists. So very often they come way too late and they end up here. And in the public healthcare system, usually, it's addressing those with severe issues. But what about the you and I, who I have issues with, just maybe some feeling depressive? You have to go to a private center, which is usually very costly. So this is where, if you talk about mental health, the community that's most vulnerable is actually those in the PPR, or the low-income housing communities. No money, not enough information, they're struggling with their daily lives, putting food on the table, just surviving school. And you can see, I want you to imagine if you're living in this 700 or 800 square feet house with 8 people in the house, with one toilet, and don't even have space to play your bike, not having that safe space where you just want to, be a youth or a child. So this is what I want to highlight, that youth, of course, youth mental health is a global issue now, but for those from the low-income community, this is a serious issue. They are already, facing a lot of adverse situations in terms of accessing rights to education, healthcare. So imagine on an individual level, there's one public health specialist who said, what if depression is a normal response to an abnormal life situation? So depression, anxiety, self-harm, stigma, substance abuse, what else? Bullying. Long list there. So this is the general adolescent mental health. So I just like to point 20% reported in the last, I think, MOH report. 1 in 5 have depression and anxiety, and about 10% have suicidal ideation. So this is just general adolescence, yeah? So whether you're rich, poor, whatever. So for us at Souls Health, we, as a community health, mental health provider, we want to address the source or the risk factors, which is often what we notice, which is common, is household dysfunction. So family conflicts, in terms of substance use, mental illness, poor health overall. So we start with this program, Kami. Yeah, so we build connections with the families, listening attentively, how to broach difficult questions, especially for teenagers. Yeah, and next we build skills. So here you see this father, we're teaching them how to understand themselves better. So emotional regulation is one of the things. This father mentioned that, hey, whenever my son screams at me, I feel I just want to hit him. So we're teaching him here how to do deep breathing, to calm your body down so you can think clearly and react rationally. One of the therapy techniques. And then for these youth, this is a safe space for them to express themselves, to share their feelings to their parents, and also for the parents to share, why am I working so hard? Because I want to give you a good life. And the children says, oh, now I get it. It's not because you don't pay attention to me. So we facilitate that process. And when then they have that connection, the capability, and they know that they matter, for example, this family now have the courage to come together and share this family tree, which is basically exploring the intergenerational successes, disappointments, issues that they face. Finally, the children and the parents can understand where they're from and what are the challenges and how they can do it together. So what we have learned from this program, Kami, is that we increased our mental health literacy. We did a lot of screening and these very useful conversations. And to also now they know that mental health is of the same importance as physical health. And stigma, again, we don't directly just address the stigma such as that. By building those connections, we unconsciously address the stigma. And another thing that we did was we are not the experts. They are the experts of their lives. They are struggling on a daily basis. So what we do is creating the skills for them to be peer support to each other, parent support and youth support. And what we have learned in that is that there's a kind of hypothesis like, hey, if we address the risk factors of mental health, when we look at individual, interpersonal, community, and understand the system are in, then these communities can do more to prevent and promote mental health. So for us who are not PPR, I'm sure most of you are, okay, I come back to a nice home as well. So what we need to know is, what we've learned from these communities is that the health of the person is actually a reflection of the community. And this is where from learning from these communities, we need to start building more strength and empower the community. And it starts by first step, just building connections with your family, with your neighbor, with each other, and with the people here. So again, when we are connected, we can create that change. And mental health starts with that connection. Thank you.
Ooh.